Hi, welcome friends. My name is Barbara Frain, and I'm the former co-chair of the ASC Foundation grant committee. Well, more than grants, we give away money, we raise money, we give away money, and we're revisiting today our 2021 awardee, Dr. Kelsey Hummel. She got the Advocacy Award and has already done a podcast with us. She's had a poster and had some work done, but she said there's been more work that has been done as a result of winning the award. And so at this time, Dr. Hummel is a fellow, cytopathology fellow at MD Anderson, and she's currently completing a global cancer care tract, which is a new opportunity through the MD Anderson fellowship program. And she is joined by Dr. Elisée from Rwanda, and she's going to introduce him more fully in a little bit, and he's going to tell you how the clinics are working in Rwanda. But first, we'll hear from Dr. Hummel. Thank you.
Hi, Barbara. Thank you so much for the kind introduction. So as we've talked about in our previous podcast, I first stumbled onto the ASC grant opportunity through my partnership with Dr. Elisée. We actually began working together earlier in 2021 due to the ASCP, or American Society of Clinical Pathology, grant for global fellows. And once we started talking, I asked him, what were the things that you felt that Shashubay needed? Shashubay is the University Teaching Hospital of Butare, which is where he's currently stationed. And so that was where he came up with the idea of these mobile cytology clinics. And so from there, that's where we applied for the grant. So just to give you a little background, I'm going to go ahead and share my screen, show you some figures and photos, and let you know how all of this really came to be. Yes, here we go. All right. Can you see my screen and this map of Rwanda? Okay. So to start off, cancer care in Rwanda is primarily done with 5 hospitals in the country. So the main hospital is up in Butaro, which is the Butaro Cancer Center of Excellence. This is the hospital that has the most up-to-date treatment, imaging, and diagnostic testing available within the country. In the city of Kigali, which is the capital of Rwanda, there are actually 3 hospitals that are available. They can do most diagnostic testing as well as some specific treatment for cancer. However, down here at Shashubay in the southern province, this is the hospital that is lacking some of the necessary diagnostic testing to really help these patients with being diagnosed with cancer. And what Dr. Elisée has expressed to me is that over the past several years, he's been noticing an increase in the number of cancer cases that he is seeing with his patients. So we wanted to understand, why are we seeing this increase? Because overall, these patients are coming to Shashubay at a later stage in their disease, which unfortunately means a poorer prognosis. The way that we can try to circumvent that is with early diagnosis and early treatment. The way that we do this is usually through fine needle aspirations, especially of superficial masses, and also tissue biopsies. To put this into perspective, Shashubay oversees 4 million patients. These are patients that are within the southern province here and part of the western province. However, only 800 FNAs are done per year. Let's put this into perspective. I'm currently in Houston, Texas. This, in just the city alone, is about 4 million people. And we have multiple hospitals, especially being at the Texas Medical Center. One hospital will have over 20,000 fine needle aspirations. So this proportion of only 800 FNAs is incredibly low. So what we talked about was, how can we try to increase the number of FNAs? How can we try to increase the number of patients that are actually seen? And so that was where we looked into trying to do a small project. Like if we tried to do the entire province, that would be huge. So let's just start with the district that Shashubay is currently located in, and that is the Huye district in the southern province. In the Huye district, there are these little red crosses here, which are called district health centers. This is where most of the patients go for their very first visit if they have a medical concern. Once they go to these district health centers, they will be referred to a district hospital. Here, this is the white cross here, the Kabutare District Hospital. Now, for patients, most of them, over 90% of Rwandans in the country do not have a car. So they are walking this distance every time. And so you also have to consider a round trip for them just to go from here to here. Once they go to the district hospital, then they get sent to the referral hospital, which is Shashubay. That's this other white cross on this side. So now if a patient is up here at this health center, they're having to make that trip multiple times just to get an FNA. And so for a lot of patients, it's very expensive because each of those doctor's visits is a copay, just like what we have here within the US. But then also think about the time away from work, the time away from family. All of these are very important factors. So what we decided to do was bring the FNAs to the patients. So this is just a recap of what a patient has to go through in order to get an FNA if we were not doing the FNA clinic. However, with the FNA clinic, where we bring the pathologist to those district health centers, the pathologists are able to perform an FNA on those patients right then and there. They receive a referral letter to go straight to Shashubay, so that you don't have to go to the district hospital at all. In addition to that, we provide them social support to be able to get transportation to go from their health center directly to Shashubay, which already decreases the amount of time that they need to travel. They can quickly go and then quickly get back home. That's a huge reduction of burden on the patients for that. And so just to quickly show you, these were some photos from the clinics that Dr. Elisée was performing. This was at one of the very first clinics where Dr. Elisée is performing an FNA. This is another one where we have our patients waiting outside, listening to the pathologist. And these are some of our wonderful techs that also were there to help with each of the clinics. And so with that, I'm going to give the, the mic over to Dr. Elisée to talk more about these clinics. Dr. Elisée is the head of service of anatomic pathology at Shashubay Referral Hospital. He's been a great person to work with and has been a real champion for making these cytology clinics come to fruition. So Dr. Elisée, please feel free to tell us about your experience with the grant and how you've been able to make these cytology clinics happen.
Okay, thank you very much, Dr. Hummel, for handing me the speech to have something said on the mobile cytology clinics. Because as the Hummel has explained, after everything has been available, the funds and all the required, documentation, because we had to also look for the permission from the hospital ethics committee, but also we had, because we're going in the community, the local administration authority has to be informed too. So we went to the district of Huye to request for permission, but also we had to request for the health direction, because the district has the director of health in the district. We had to inform him, but also we had to inform the director of the district hospital, the capital, because we will be working hand in hand. But also the heads of the health centers have to be aware too, because these are the ones we are going to visit at the health centers. So to introduce them to the project, we had to do like a seminar whereby we invited all the leaders of the health centers, the director of the district hospital, the director of health in the district, first of all, to introduce them the project before we go to the community, because they are the ones who are going to do the sensitization and advocacy. But also, not only them, we had also to be together with the so-called community health workers. So the community health workers, those are the ones who are going to do the sensitization house by house, telling the people that, hey guys, at this exact time, there's a team of experts which is coming to our home. If you ever have a tumor or somewhere else, you are invited. So we had a seminar with them whereby we introduced to them about the introduction to cancer knowledge, because community health workers, they deal with some other diseases like malaria or any other disease. But if you want them to tell the people about cancer, you have to equip them with some knowledge first. Yeah. So we met, and then we had that kind of training on cancer, whereby we did the presentation with my colleagues on cancer, but also we handed over them the leaflets where there is some information on cancer. What is a cancer? Types of cancer, diagnosis of cancer, so that back home they can distribute those leaflets to the people, so that by the time we go in the community, they are already aware. Okay, so we had that training. And after a successful, I can assure you that almost all the people that we're expecting to attend that training, they all came, exactly like more than 100%, if I can say. So all the community health workers that we had invited, they came all without one missing, all the heads of the health centers, which was really encouraging. And after that, then we had to do some announcements on the due date. So we could say at this exact date, we will visit this health center, and we give the communique on the radio, on the local radios. Here we have the local radios. There's the so-called the South radio and the Huye radio. We have two radios here around, so used to give the communique on these radios to call upon the population. But also we have the so-called market radio. Here in Huye town, we have a marketplace, so there's a radio there where people can advertise something. Yeah. So after doing all those kind of advertisements, the way we did is that one pathologist together with the laboratory scientist and a nurse could join each health center. But also we had prepared that at each health center, we have at least one nurse of that health center who will help us with the logistics. If we are visiting a given health center, we need someone who is familiar with the place to guide us, but also to help us arrange with the population, because he's the one who is knowledgeable with the population. He could handle well the population. So after arriving at that health center, what we do is the introduction, and then we had also to give a talk. Before we do the actual FNA Act, we had also to do some kind of introduction also on what is an FNA, how is the FNA done, but also we need some information. There's a project that we're doing with Kelsey about the factors, the factors that can, permit people not, seek for the treatment. So we had some elaborated questions whereby the people were being asked something, and then they were responding on that project to know the factors that can influence, the people to seek or not seek the advanced treatment. So after that discussion, the knowledge on cancer, that kind of project, then that's where we straight go to the actual FNA Act. As we had explained, you all know, for the FNA, it has to be a palpable lesion. So some of the patients, because it was an advertisement, many of the patients were coming without having a lesion which was worth FNA-able, Maybe some were having just, some dermatosis, which are not indicated for FNA. So we had to do, to examine quickly the patient to see who is candidate for FNA, who is not candidate for FNA. Yeah. So after knowing who is exactly candidate for FNA, so we straight go for the act. A pathologist together with a laboratory technician or a nurse around, we are working hand in hand in order to do those FNAs. So after that, doing those FNAs, we had the contact of those patients. In case we find a suspicious lesion, because you can't say everyone who has got an FNA has to go to CHUB, but any patients whom we find a lesion which is suspicious of cancer, that one we transfer her to CHUB for subsequent open biopsy and then histopathology. So that's what we need. And any patient who is coming to CHUB, as Dr. Hummel said, we give him some, some little money for transportation, because we know one of the reasons why, patients there in the countryside, they may, stay at their home because they have lost, the ticket, the transport is an issue, because even if it is here within the same district of CHUB, but they are a bit far. You can't walk from your home to CHUB and then from CHUB to your home the same day. So many of them will remain at their home, and then the cancer or even any other lesion may reach the advanced stage because they have lost the ticket. So at least for someone we suspected, we wanted at least him to reach the hospital. Yeah. So that's what we did, and we gave the assistance, and then people came here to CHUB, and then those who have found confirmed cancer, they have progressed with the process of the hospital. Because our main issue was, because it's not only doing the FNA, because the people who are there, maybe in 1 year or after 1 year, some other regions will develop, but the knowledge that we equipped with them may help them maybe in the other time to come to the hospital. If we go to a health center, doesn't mean that we have screened all the cases. There are some patients maybe who have stayed at their home, but the knowledge we gave to them, understandably, will have something to do with the subsequent visit to the hospital. So we are happy with what we have achieved now. At least for the Huye district, we wanted to do this as a baseline to see if is it really possible to do a mobile cytology clinic. And in the end, we saw that it is possible. So now Huye is in the same district where the CHUB is, but as Kelsey said, CHUB covers even some western province district or Rwanda. It is very far. The patients, they can't leave their home and come and get treated here and then go back home the same day. No. So now, for the subsequent, the grants, if it ever happens, we want to go far from the Huye district now, because we know that we can find many patients there too. Yeah. So I think that's what I can say. We are happy with what we have achieved, and we really thank the American Society of Cytopathology to have made all this happen, because it has enlightened us and it has showed us that what we had as an assumption is possible. And maybe we have the base, now we have the base. We have something that we can tell to people whenever we go to apply for other grants. We say, hey, with the American Society of Cytopathology, we came up to do this. Can you give us some other guys? Oh, yeah. So it has been a very good baseline, because now we have data. We have data now. So for the subsequent projects, it won't be like you know, it won't be like just a saying. Yeah, because we have something to show. Thank you very much.
Oh, thank you so much, Dr. Elisée. I love that there's a system being developed and the system is working and you can grow and expand on that. And I think a lot of us think about, oh, set up a fine needle clinic, you know, you need slides and gauze and stain and needles. I'm thinking back to what you said about the community education piece and the leaflets and all that goes into just getting ready to get started with this. It's amazing to me. So what a well-designed plan, and it sounds like it's been successful and will continue to be successful. Dr. Hummel, do you have anything to add?
My big thing here is that I feel that a lot of my job has been to help with getting the funds in place, but I just really applaud Dr. Elisée and his team for actually doing the work to get all of this together. I agree with you, Barbara. Like, once Dr. Elisée started explaining to me all the levels of the community that needed to be addressed, that needed to be informed, I was just like, this is a much bigger project than just grabbing some materials and going out and doing this. So just incredible work. And when I've gone to lots of conferences and I've showed them this project, so many people were very impressed and just thought that it was a great initiative to really bring the medicine kind of full circle and actually bring it to the communities.
Well, I think that embodies everything that the foundation loves to see with an advocacy grant and exceeds expectations. I'm so grateful that you came back today and came to us with the idea for a part 2. I think that all of our members will be interested in learning about this, and I think it serves as a template for success in other areas. So thank you everyone for your time today, and we appreciate you participating, and we appreciate our listeners for tuning in. Thank you.
You're welcome. Thank you.